Good evening and welcome to the Intensive Care Society Awards for 2023. I'm Steve Mathieu, President of the Society, and I'm joined by Sandy Mather, who's the Chief Executive, with the pleasure of hosting this evening's awards. Sandy is a seasoned professional at hosting our annual awards ceremony now, but this is my first opportunity to join her, so I'm thrilled to be involved. These awards with an opportunity to recognise individuals, teams, hospitals and organisations who go above and beyond to improve intensive care. Thank you for joining us this evening to mark this occasion and to recognise all who have been nominated in one of our many awards categories.
We've had another excellent year of submissions and we're very proud to be bringing you tonight's event to recognise all the hard work and dedication that's gone into delivering projects that develop better service provision and provide better care for patients across the country. This year, we've introduced a great many new award categories to help recognise even more excellent work that you all do. We've had some excellent nominees in each category, but unfortunately, there can only be one winner in each. So without any more preamble, we'd like to introduce our President-elect, Shond Lahar, to tell you about our first category.
Good evening, everyone. As President-elect, I'm looking forward to taking over Steve's role as host of these awards in the future. For now, though, it's a pleasure to introduce our first few awards. The first category tonight is our Intensive Care People Awards. These recognise some of the individuals in our community who have really embodied our values, shown outstanding leadership or gone above and beyond to support the clinical ICU team. Some are brand new awards for this year. Others you will have seen before during award ceremonies past. Good luck to all our nominees for each of these awards, and I'll hand back to Sandy and Steve now for the first award.
Thanks, Shond. It's nice of you to make a cameo, but nice to know my role as host is safe for now. Before we move on to our next two award categories, we'd like to take a moment to acknowledge our People of the Year winners in each category as nominated by you. You might even hear a couple of familiar names coming up. These awards recognise healthcare professionals who've overcome personal or organisational difficulty to embody the Society's values or the values of their trust. We've had some great nominations and know of plenty of people who fit this category. But Sandy's got our list of winners all ready to go.
Thanks, Steve. Well, in no particular order. Our Specialty Doctor of the Year is Caroline McConnell. Our Pharmacist of the Year is Natasha Hamilton Tanner. Our Occupational Therapist of the Year is Amal Magpante. Our ACCP of the Year is Kerry Angus. And our Dietitian of the Year is Michelle Rutledge. Our Nurse of the Year is Kim Vigus. Our other ICU Clinician of the Year is Bex Parsons Simmons. And hold on, I think I've got a bit of a typo here. Apparently our Consultant of the Year is our very own Stephen Webb. Congratulations to everyone recognised in this category tonight. We're so pleased to be able to acknowledge all your hard work.
So the next of our Intensive Care People Awards this evening is for Outstanding Leadership. This award recognises an individual at any level who has shown outstanding leadership in an intensive care unit, hospital or organisation. We have 11 nominees for this category, a testament to the excellent leadership being modelled in intensive care across the country. The nominees are Dexter Calapit, Mark Snezell, Rajesh Jain, Elaine Thorpe, Francesca Rubelotta, Jane Kirk-Smith, Laura Midwood, Maria Famador, Mohammed Noor, Nikki Credland, and Tracy Spacey. And the winner is Nikki Credland. Nikki chaired the British Association of Critical Care Nurses for several years and led the organisation through the COVID-19 pandemic, resulting in her being thrust into the spotlight during an unprecedented time. Her calm, unwavering and confident articulation of the challenges faced in critical care settings was a powerful representation of the nursing profession as a whole and was immensely valuable in helping government, representatives and the public alike to better understand the situation at that time. Nikki stepped down from her role as chair in September and is a very worthy winner, so it's great to be able to recognise her tonight. Well done, Nikki. And now it's over to Sandy for our next award.
The next award is our Going the Extra Mile Award. It's a popular category each year and one we love giving out, as it recognises someone who's not a clinician and has gone above and beyond to support intensive care staff and patients in the last 12 months. Here you nominated Free Morgan, Raina Kupperblatt, Ruth Cox, Sekai Katsandu, and Catherine Ridgewell. And the winner is Catherine Ridgewell. Catherine is the Band 5 Project Support Officer for Thames Valley and Wessex Adult Critical Care Network. Despite sharing her time with another specialty network, she manages to go above and beyond to ensure the critical care network is supported. As a more administrative role, the impact of her work may go unnoticed by many. However, the work she does adds huge value to staff within their units and to patients. Congratulations to Catherine. That's all for the Intensive Care People Awards. We're now going to hand over to our Honorary Treasurer, Paul Dean, to tell you all about the Intensive Care Organisation Awards.
Hello everyone, it's nice to be able to join you this evening to help Sandy and Steve give out these awards. As Sandy mentioned, the next category we're going to announce tonight is our Intensive Care Organisational Awards. The awards in this category are given to units, hospitals or organisations who provided outstanding care to patients or support to staff or have embedded positive cultural change. We're in great company when it comes to organisations working to support intensive care, and we're glad to be able to recognise some of our friends and colleagues. There's lots of great nominees to hear about and winners to announce, so I'll hand back over to Sandy and Steve for our next category.
Thanks very much, Paul. The first of the awards in this category tonight is Team of the Year Award. This award recognises a team within ICU who have navigated a problem or pressure to provide outstanding patient care. This year's nominees are the Critical Care Team at University Hospital Bristol and Weston, the Royal Papworth Hospital Speech and Language Therapy Team, the Golden Jubilee ECMO Team, the North East Cumbria Transport and Retrieval Nectar Team, the Harefield Hospital MLS Team, the Neuro ICU at Wessex Neurosciences Team, the Royal Brompton Hospital PICU Intensivist Team, Royal Cornwall Hospital's NHS Trust Rehabilitation and Follow-up Team, Stoke Mandeville ICU Team, and the Physiotherapy Team at Royal Papworth Hospital. It was impossible to separate two of our nominees in this category this year, so we've actually got two winners for you tonight, and those winners are Royal Cornwall Hospital's NHS Trust Rehabilitation and Follow-up Team and the Neuro ICU Team at Wessex Neurosciences. Many congratulations. Staff Critical Care Rehabilitation and Follow-up Team has been in place at Royal Cornwall Hospital's NHS Trust for the last 3 years, and the team includes representatives from their medical, nursing, physiotherapy, occupational therapy, psychology, dietetics, speech and language therapy, pharmacy and secretarial staff. The team provide a fully GPICS compliant rehabilitation programme for all patients, and the most significant impact has been the consistent delivery of a holistic model of patient care. The Neuro ICU Neurophysiotherapy Team is a small dedicated team of highly experienced individuals who work closely with clinicians on their 13-bed neurointensive care unit at Southampton. Their work with patients adheres to the belief that excellent clinical care and regular high-quality physiotherapy can avoid the need for a tracheostomy in brain-injured or high spinal cord injured trauma patients in the majority of cases. This reduces the length of ICU stay and helps them to return to home sooner.
Next, we have our Association of the Year Award. It recognises an association or organisation who provided outstanding support to intensive care staff this year. The 2023 nominees are Rescue, the Adult Critical Care Transfer Service for Thames Valley and Wessex, and Cujam Paramananthem and the Thames Valley and Wessex Adult Critical Care Network. Two excellent nominations, and both from Thames Valley and Wessex. And the winner is Rescue. Rescue is the Adult Critical Care Transfer Service for Thames Valley and Wessex. It was established in December 2020 to provide a dedicated critical care transfer service 7 days a week, 365 days a year within the region. The team have now undertaken more than 2,000 critical care transfers. The dedicated multi-professional rescue team ensures a seamless transition of care between critical care units by providing a single point of contact, fully trained and competent staff, equipment, and a specialist vehicle to safely and effectively undertake the transfer. Congratulations to the rescue team.
Our next award this evening is the Collaboration Project of the Year Award. This recognises a unit, hospital or organisation who embarked on a collaborative project at a regional, national or international level to improve the experience of intensive care staff or patients. The shortlisted nominees are Anna Voyages and her work on rehabilitation after critical illness, Carmel Richardson and the LMSC Critical Care Network Allied Health Professionals Training Needs Analysis Project, Lisa Hayward and the Patient Rehabilitation Guide booklet, Sean Morgan and the Lancashire and South Cumbria Critical Care vancomycin Guideline, and Brenna Fossey and the William Harvey Hospital Tracheostomy Working Group. And the winner is Lisa Hayward and the Patient Rehabilitation Guide booklet for Blackpool Teaching Hospitals NHS Trust. As part of the Lancashire and South Cumbria Critical Care Network, a rehabilitation task and finish group was set up to assess how services can be improved for patients. Within GPIC standards, patients must be given information explaining how they can help their recovery. The group wanted to improve patient information with a patient rehabilitation guide. This aimed to provide patients with information supporting their recovery on discharge from critical care. The guides were developed using a multi-professional approach with input from all professions as well as patients. A great piece of work by the team, very well done.
Our Team Support Award is next on tonight's agenda, and it recognises an individual, team or unit who have developed a programme or other tools to support their intensive care staff. Shortlisted nominees are Dan Barry and Ina Roman for DB Rotors, Laura Coleman for Team Time and Brew an Event, Russell's Hall Hospital, Samantha Hinton, and David Anderson in his role as chaplain at East Lancashire Hospital Trust. And our winner is Dan Barry and Ina Roman for DB Rotors. Dan and Ina have created the software DB Rotors, which has facilitated bespoke ICU rota design at University Hospital Southampton. The rollout of their rota system has dramatically improved the working lives of staff on the intensive care unit, both at UHS and also at 2 other sites across the Wessex Deanery, Queen Alexandra Hospital and Hampshire Hospitals Foundation Trust, where it rosters 150 individual clinicians and 4 intensive care departments. Their rota system has revolutionised the departments that have integrated it. At UHS, it serves as a custom platform where individual clinicians can request their time off, study leave, and not on-call requests immediately before the rota is generated. The rotas are cross-platform, automatically generated and compliant with employment rules. This not only creates a portable, reliable system for working staff, It has also massively reduced the burden of rolling rota writing by consultants and admin teams. Also, over the course of their rota system rollout, more than 99% of study leave and annual leave requests have been approved across departments. Congratulations to Dan and Ina on what sounds like a fantastic project to support staff.
The final award in this category this evening is our EDI Project of the Year award. This award recognises an individual, unit, hospital, trust or organisation who have implemented a meaningful programme of change to further a culture of inclusivity in the workplace. Our ED work is something we feel is tremendously important, so it's great to be able to recognise other important work happening in our community. Tonight's winner of the EDI Project of the Year is Elizabeth Mercado and the Critical Care Unit EDI team at Salford Care Organisation. Staff from ethnic minorities reported they did not feel they always had the support to develop and equal opportunities to progress. From this feedback, the EDI group was established with the aim of creating a supportive environment where all staff feel they have equal development opportunities and a voice to speak up, and where all patients are supported irrespective of background. The group have held monthly focus events, including a Black History Month celebration, recognising the contribution that Black people have made to society, an Onam and Filipino celebration event showcasing their culture, food and music, and an LGBTQ and History Month. These events have given the staff opportunity to share their stories, and the team have developed practical support mechanisms for staff to aid their day-to-day working, which have had positive staff feedback on evaluation. Congratulations to the team on what sounds like fantastic work. Well done. It's now time to welcome another special guest for this evening, our Honorary Secretary, Andy Breen. He's going to tell us about our next awards category.
Hello everyone, it's nice to be joining you to talk about the Education Awards on tonight's agenda. It's been a big year for us in terms of learning, and it's great to see that it's been a big year for others too. These awards are about celebrating great educational programmes, learning events or support that's been provided to help develop ICU staff. We've had loads of great nominations from all over the country for some really inspiring projects. And now it's back to Sandy and Steve to find out our winners.
Sandy, you're right. We've got some great nominees for our Education Awards this evening. They may even provide a little inspiration for our audience too. The first award is our Best New Education Programme Award, which recognises an organisation, unit or hospital who have developed a new educational programme for intensive care staff. It was a very popular award this year, so we've got plenty of nominees to recognise. This year's nominees are Anna Riley, Clinical Nurse Educator at William Harvey Hospital. Deployed Intensive Care Equipment DICE course by Defence Medical Services. Prabjoit Kia and Amy Knight for their Critical Care Multidisciplinary Simulation. The British Dietetic Association Critical Care Specialist Interest Group, Introduction to Critical Care Dietetics. The Care Ultrasound Training and Education Programme at Harefield Hospital Intensive Care Unit. Critical Care End-of-Life Training at Pinderfields Hospital. John Aaron for Hemodynamic Assessment of Critically Ill Patients using echocardiography. And there's more. Kirsten Gear for the North Cumbria Multidisciplinary In Situ Simulation. Laura Coleman and the Oldham Critical Care MDT Simulation Group. Robert McLean for the Multidisciplinary Intensive Care Teaching Programme at Pinderfields General Hospital. Selin Kabadayi for Your Track. Kingston University's Critical Care Online Blended Learning Programme for Nurses. The Scottish Intensive Care Society's Evening Education Updates. The Severe Acute Respiratory Failure Course team at University Hospitals Bristol and Western NHS Foundation Trust. And multidisciplinary simulation-based medical education for Team Talent University Hospital. So many excellent nominees. And the winner is Kingston University's Critical Care Online Blended Learning Programme for Nurses. To meet new requirements, the team were required to radically change their critical care nursing course delivery from 100% face-to-face to a blended online programme covering the CC3N Steps 2 and 3 curricula. The change to delivery posed educational challenges for the team, demanding new methods, technical skills, and leadership approaches as they moved forward with their new programme design and delivery. They championed learning rooted in problem resolution through teamwork and involved the interprofessional team in designing the content. They've had excellent feedback from students and should be proud of a well-deserved win. Well done, team.
Next up is a new award for 2023, our Best Professional Development Award. This recognises an organisation, unit or hospital who have developed resources or networks to assist ICU staff of any profession within their career development. So tonight's nominees are Anoma Gunawadena, Denise Breen and Judy Cottrell for their work with Royal Brompton Hospital and University of West London, the Harefield Hospital ICU Practice Development Team, London's ICU Clinical Practice Education Team, Thames Valley and Wessex Adult Critical Care Course Marketing Team, and Teresa Famador for her Career Development Programme for nursing staff in anaesthetics, theatres and critical care. And the winner is Anoma Gunawadena, Denise Breen and Judy Cottrell. A key part of critical care nurse development involves higher education. Anoma, Denise and Judy are intensive care matrons who have championed a hospital. University partnership between Royal Brompton Hospital and the University of West London, which provides access to an intensive care badged MSc in clinical practice within 1 year of starting in critical care. The hospital and university have worked in partnership since 2017 to provide critical care nurse education via an embedded lecture practitioner role and the delivery of degree and master's level modules to nurses by an in-house nursing education team working in critical care on the Royal Brompton site. Modules delivered in this way include the postgraduate certificate in intensive care and the first university-based ECMO specialist module for nurses in the UK. The aim of the partnership is to guarantee access for every critical care nurse on a high-quality, university-accredited critical care course, which is academically rigorous, relevant to the specialist context of care, and which meets the national standards. Congratulations to the team on what sounds like a fantastic partnership.
The last of our education awards tonight is Best Educational Event on a Budget. This award recognises an organisation, unit or hospital who have organised an educational event for ICU staff with a small budget. And tonight's winner is David Clerter for the Ox-VASC education course. David has designed and implemented the Oxford Vascular Access course, which has become well recognised and is in high demand, not only by doctors rotating through the intensive care department, but throughout the Oxford University Hospitals NHS Foundation Trust. This course is offered monthly, free of charge to doctors throughout the trust, and its primary focus is to train individuals comprehensively on ultrasound-guided vascular access, central line and PICC line insertion. Congratulations, David. It sounds like an excellent course. We've had such worthy winners so far, and it's great to be able to reward such outstanding work. But which category will be next? We've got a special guest now, Marlise Osterman, one of our Directors of Research and the Chair of our Standards Division, to tell us all about it.
Hello, everyone. I'm really glad to be able to join you this evening to celebrate all of you and the work you do every day. These next awards are our Future of Intensive Care Awards, all about what's on the horizon for ICU and how we ensure our future is as bright as it can be. We particularly recognise people and teams who've done significant work to retain their ICU staff or who've made a real impact with their research. We've had some great nominees, and now it's back to Steve and Sandy to hear more.
Thank you very much, Marliese. The next award on the agenda this evening is one Marliese knows all about. It's our Research Award. As many of you know, research is something we're passionate about supporting, so the award recognises a research team whose work has had a major impact on critical care service provision. Our nominees tonight are Tharwat Asa, Senior Fellow in Critical Care at Manchester Royal Infirmary, and East Lancashire Hospital's NHS Trust Critical Care Research Team. And the winner is East Lancashire Hospital's NHS Trust Critical Care Research Team. 2022 to 2023 has been a pivotal year for the team. COVID hit the region quite hard, and research was one of the areas which suffered, having only 22 patients be randomised to 2 trials in 2019-20. But the current critical care research team this year, able so far, have eclipsed those figures with 278 patients randomised across 10 live NIHR trials. This transformation has been down to the implementation of a monthly research meeting. Whilst a very simple low-tech solution to an engagement problem, by holding these meetings each month after critical care MDT meetings, a research hub was created. These open meetings provide a focus point for all research-minded or research-interested individuals to come along and get involved and get up to date on trials being run. This further promoted the research team as attendees spread both research ideas and the research team itself to other staff members. Sometimes the simplest ideas are the most effective, and it's lovely to see how successful this has been for the team.
Now it's time for our Retention Campaign Award. Retention of ICU staff is absolutely vital. So we're glad to be recognising a unit or hospital who have run a successful campaign to retain intensive care staff. Tonight's winner of this award, new in 2023, is the Critical Care Progression Pathway at Royal Cornwall Hospital. With the critical care workforce in crisis, their remote location in Cornwall and role as the only acute hospital in the county, the team faced a multitude of issues with recruitment and retention. They reviewed all staffing, budgets, headcount and models, and explored what was achievable to grow and retain their own staff, as well as attract other staff to critical care. They also couldn't increase budget nor decrease headcount. So they altered the skill mix in their department by reviewing their nursing and critical care assistant roles and created a competency-based progression pathway, which means that on completion of specific competencies, staff can be moved into an appropriate role without having to interview. Well done to the team on a great programme. There's just one more category to go this evening, so we'd like to welcome a friendly face. Our National Wellbeing Project Director, Julie Highfield, to tell us all about it.
Hello everyone. It's so nice to be part of this evening, acknowledging all of you and all of your great work. These final few awards are for those of you who've been great supporters of intensive care over the past year. We're celebrating people who've volunteered their time and expertise, those who've advocated to improve the experience of ICU staff, and teams who've developed resources to improve the experience of their patients. As with all our other nominees tonight, the people we're about to recognise are all worthy of celebration, but there can only be one winner. So it's back to Sandy and Steve for our last few awards.
The first of our awards in this category is for the best patient resources, recognising an organisation which has developed informational resources for ICU patients or their loved ones. Tonight, we're very pleased to be recognising Laura Coleman and Leah Chapman from the Northern Care Alliance NHS Foundation Trust for their obstetric critical care patient resources. To improve patient experience for their obstetric critical care patients, the team have introduced a patient resource pack alongside staff resources in their critical care unit. A pack is available for each obstetric critical care admission, and it includes guidance for bottle feeding, instructions for using various devices and medicines, and items like bonding squares. The packs have required input and training from obstetric, anaesthetic, intensive care medical and nursing staff, midwifery and infant feeding specialists, as well as patients and families who've shared stories of their experiences on intensive care. It's a great initiative from the team and one we're really glad to recognise. Well done.
Well, we're nearly at the end of tonight's ceremony, but we've got 2 more awards to give. Our Volunteer of the Year award recognises an individual or group who have volunteered their time to improve the experience of intensive care patients. We've got a couple of great shortlisted nominees this evening. Louise Galley for her work volunteering with Plymouth Hospital and advocating for improved patient care. Alan with the Pets as Therapy dog, Daisy Williams. And the winner is Louise Galley. Louise is a former ICU patient who uses her experience of being in critical care to support others going through similar journeys. Louise has always advocated for improved patient care, using her experiences of delirium and recovery to make a positive impact on the lives of others she encounters. You may also have seen Louise speaking at our state-of-the-art Congress in Birmingham this past June. Louise volunteers her time in the intensive care unit at Plymouth Hospital, supporting therapeutic activities like support physiotherapy. She takes a person-centred approach, using activities each person will find the most meaningful, therefore promoting their well-being and engagement. She has also been influential in the development of a therapy garden, so patients in intensive care can go outside, and even support gardening and associated projects if possible. She's also been key in the development of the Rehab Legend campaign. Congratulations, Louise, and thank you for all the work you do supporting intensive care patients. And now it's over to Steve for our final award of the night.
Thanks, Sandy. We've nearly made it to the end of the evening. The last award we've got left is to give our Advocacy Award. This recognises an individual or group not working in healthcare who have contributed their time and energy to publicly advocate for intensive care patients and staff. Tonight's winner is Jackie Brewster. Jackie's 19-year-old daughter Emily was a patient on Pencarrow Intensive Care Unit in December 2018 following a road traffic collision. Sadly, Emily's injuries were not survivable. Emily had registered her decision to be an organ donor, and a family honoured and supported her decision. Emily went on to save 8 lives through organ donation. Jackie has combined celebrating Emily's legacy, her passion for running, and her tireless determination to applaud the kindness and care received in intensive care by setting up Emily's Run. This is an annual sponsored 10K run event, the proceeds of which are gifted to the Pencarrow Nurses Fund to support nurses' wellbeing, education and study. The first Emily's Run raised over £3,100. Jackie continues to support Pencarrow ICU and to raise awareness of organ donation, making her a very worthy recipient of tonight's award. Congratulations, Jackie, and thank you for the work you've been doing.
And that's a wrap. Thank you everyone for joining us this evening to celebrate the talent, dedication and hard work of everyone working in and supporting intensive care. We'd like to again congratulate all the winners of tonight's awards and all our shortlisted nominees. Choosing just one winner in each category was made all the more difficult by the incredible work you're all doing every day. We hope you all enjoy the rest of your evening, and on behalf of myself and all the team at the Society, Thank you for joining us.
Perfectly said, Sandy. I'd just like to add my thanks to everyone as well. It's been a pleasure to host my first awards as president of the Society. It's been inspiring to hear about all the work that's happening out there in units across the UK. We look forward to seeing you all again next year, and I'm so excited to see what you'll get up to over the next 12 months. Well done and thank you.